Hi, thank you for listening to our Vision for Autism-Friendly Healthcare, a community forum, and for giving your input. Autism New Jersey is a nonprofit agency committed to ensuring safe and fulfilling lives for individuals with autism, their families, and the professionals who support them. We are grounded in science, strengthened by knowledge, and devoted to creating a society of compassion and inclusion for all those touched by autism. Our values are dignity, compassion, accessibility, progress, collaboration, and excellence. We have 4 service pillars. First, information services, which includes, among other things, our helpline, 1-800-4-AUTISM. Second, clinical expertise, that it provides education and also includes our annual conference. Our third service pillar is public policy, where we advocate for systemic statewide change to better support the autism community. And fourth is awareness and acceptance, including our annual ambassador campaign. We also have 2 statewide initiatives, Advancing Healthcare and Law Enforcement. Both of these initiatives focus on promoting safer and more positive experiences between the autism community and healthcare providers and law enforcement professionals. Today, we're going to talk a little bit more about our Advancing Healthcare initiative, which seeks to address the health disparity experienced by New Jerseyans with autism. Over the last couple years, some of our efforts and successes include the ongoing gathering of lived experiences through our Healthcare Experiences Survey, which I advocate everyone fill out if they haven't already. Our medical equipment lending library, which allows autism professionals to practice medical procedures in a systematic and realistic way with individuals with autism. We've made significant outreach to pediatric providers through our online pediatrician resource hub, and we author content for the New Jersey chapter of the American Academy of Pediatrics and their members. We've given numerous professional presentations for healthcare systems, healthcare providers, students, and professional associations on autism-friendly practices in healthcare. And finally, we establish and currently are ongoing leading a one-of-its-kind interdisciplinary healthcare consortium that connects autism service professionals and healthcare leaders focused on this work. Both our Advancing Healthcare and law enforcement initiatives have a strong focus on the promotion of autism-friendly practices. Autism-friendly practices are those that create a welcoming, accessible, inclusive, and supportive environment for those with autism. These are practices that mean being aware of the social engagement, communication, and environmental factors that affect people on the autism spectrum, and making modifications to communication methods and physical space that will better suit individuals' unique needs. Sensory and communication accommodations play a large role in autism-friendly practices. While that definition gives a general description of autism-friendly practices in any setting, we need to ask the question more specifically, what are autism-friendly practices within healthcare settings? There are many best practice examples and published research on potential practices. However, there is really no consensus of a comprehensive, actionable standard of practice in the implementation of autism-friendly practices in healthcare settings. So, one of the first work products resulting from our Healthcare Consortium's combined expertise is an attempt to provide that for healthcare settings. We've created the Autism-Friendly Healthcare Practices, a self-assessment and quality improvement tool. It is a comprehensive list of autism-friendly practices designed to help healthcare organizations, including primary care, ambulatory settings, specialty care, and hospital settings, to evaluate their practices, policies, and procedures for supporting autistic patients and their families. It clearly defines best practices, provides a method of self-assessment, and provides resources and practical guidance on how to implement autism-friendly practices in their setting. It was developed through careful review of research, investigation of existing best practices in healthcare settings throughout the country, input from autism professionals and healthcare providers with educational and practical expertise, caregivers of autistic patients, and autistic self-advocates. This self-assessment and tool has 4 main goals and purposes. First, It helps healthcare settings self-assess their current status of autism-friendly practices implementation. Second, it gives them a first step in prioritizing what autism-friendly practices they can implement or improve upon. Third, it provides a framework and guideline to start the work needed to provide a more supportive, inclusive, and autism-friendly environment. And finally, it gives initial resources and direction in implementing and improving their practices. The self-assessment and QI tool is broken down into 6 main categories of autism-friendly quality indicator practices. They are training, communication needs, physical space, challenging behaviors, delivery of care, and administration and culture. Each of these 6 main categories has a definition and a rationale. This definition and rationale outlines for healthcare settings what exactly does this category mean and why is addressing it important for autistic patients. Then, each main category has several specific actionable quality indicators within them. Each quality indicator within those categories also has a definition and an assessment scale where a healthcare setting can say whether they're not doing it at all, they are implementing that practice but somewhat inconsistently, or they're implementing it fully and consistently. Now, we'd like to provide you with an overview of what is covered in each of those 6 main indicators. Under the training quality indicators, things such as basic information and training for all employees is covered, as well as specific and advanced training for others in the healthcare setting dependent upon their role. So, for example, all employees should have some information on autism and autism-friendly practices, but a bedside nurse needs much more in-depth information on how to implement autism-friendly practices and how autism may be affecting her patients than someone who's working in the HR department needs. This category also addresses quality training factors. So explaining to a healthcare setting what exactly a training should have to be a high quality training, such as being competency based, being required for employment, having a hands-on aspect, things such as that. Next category are the communication needs quality indicators. These indicators address things such as providing training specific on the communication differences seen by individuals in the autism spectrum, having alternative communication materials available for patients, having a method of proactively identifying when someone has individualized communication needs and then accommodating them, and finally, also indicators such as addressing patients directly and involving them in decisions in a way that they are able to participate as fully as they can. The third main category are physical space quality indicators. These specific indicators address things such as asking healthcare settings to make environmental modifications as possible. It's a recognition that not all settings are able to create a separate waiting room or a sensory-friendly exam room. If they're unable to provide these types of specific spaces, we do also want them to consider having sensory materials provided and also considering safety for patients who may exhibit some types of dangerous and upsetting behaviors. We also address asking healthcare settings if they're able to allow patients to become more familiar with the space, visiting outside of appointment times, taking longer to explore the setting prior to an exam, items such as those. The next main category are the quality indicators addressing challenging behaviors. The items addressed under this category are things such as providing training to employees on the reasons for challenging behavior and having an understanding as why some of their autistic patients may exhibit these types of behaviors. Providing verbal de-escalation and less restrictive crisis intervention training, especially for employees that have direct interaction with patients. Asking healthcare settings to have a system where they're able to proactively identify when a patient may exhibit these types of behaviors so that they can prepare and respond more effectively. And finally, items such as having safety materials available to help keep employees and patients safer should challenging behaviors occur. The next category directly addresses quality indicators associated with the delivery of medical care. Items in this category include proactive identification of patients that have individualized needs to be accommodated, and then along with that, providing advanced planning and care coordination so that when a patient is identified as having individualized needs, the team is ready, willing, and able to provide them. This also includes communication among team members, so those providing care for the autistic patient are prepared to provide those accommodations, and an interdisciplinary approach involving autism professionals and autism experts and behavioral experts if possible. And ideally, we ask that all healthcare settings have a flexible approach to providing care, that they're doing their best to provide the accommodations that are requested by their autistic patients or their caregivers. Our last category is the administration and culture quality indicators. These specifically address how does the healthcare organization at large support these efforts for autism-friendly practices. Our specific quality indicators in this category are things such as, does the healthcare setting include neurodiversity, autism, and intellectual and developmental disabilities into all of their diversity efforts? When they are addressing quality improvement, are they utilizing self-advocates and family input when creating policies, procedures, and changes? Do they consult with or employ autism and behavioral experts? Does the administration lead a culture of listening to patients and providing accommodations and being flexible? And ideally, is the culture in the administration able to provide any type of financial support for initiatives? This may be as complex as providing money for a sensory-friendly exam room, or it may simply be allowing for a slightly longer new staff orientation time to add additional training. Even through this just brief overview of this self-assessment and quality improvement tool, you can see how complex autistic patients' needs are and how many autism-friendly practices there can be. It's important to remember that healthcare settings are complex, as are patient needs. Even embarking this self-assessment and quality improvement process, no setting will do all of these things perfectly all the time or right away. So now we'd like to provide a couple examples of how different types of healthcare settings could utilize the information they gather during this self-assessment process and how they can use it to drive quality improvement change. So for the first example, a large hospital uses this tool and finds they score relatively well on training and communication need indicators. In the areas that need improvement, the quality improvement team for the hospital chooses the physical space and delivery of care categories to focus on. So within the physical space category, they work with Child Life to create sensory bins available on each unit. And they also collaborate with the leadership from Environmental Services and Physical Plan to develop a short training and things to think about tip sheet for all of their employees that are responsible for maintaining, upgrading, or designing and building physical spaces. Under the delivery of care category, they create a simple individualized need to know about me care plan document and work with informatics to create a template in the medical record, the electronic medical record, and a pop-up alert that will show anyone working with that patient that they have that individual plan. They also finally identify and train a small group who will create the care plans that include social workers, psychiatrists, and nursing leaders, an interdisciplinary approach to a care plan, and a way that everyone can be aware that that care plan exists. Here's another example at a very different type of healthcare setting. A small physician-owned GI practice uses this tool and finds that unfortunately, they're doing nearly none of these things. They have one desk clerk who has a child with autism, and they usually help everyone out with autistic patients. They decide to start small because they're a small practice without a lot of resources, and they focus on the training and communication needs because they feel that that will be the most impactful for their patients. Under the training category, The co-owners, the physicians, reach out to a local college and find a psychology graduate student that will develop and deliver an online training about autism for all of their staff. The physicians themselves find and take a few online continuing medical educational classes on autism and related GI disorders. To address the communication needs category, that same graduate student also trains the desk clerks and schedulers for the practice to ask 2 simple screening questions about communication differences for all new patients. So when a patient calls to make an appointment, these desk clerks and schedulers are now going to ask these 2 simple screening questions as a way to proactively identify anyone who may have some communication differences. Finally, the co-owners, the physicians, watch a webinar on visual supports, and they themselves develop a few to have available for patients for their most common procedures. And our final example is from an inpatient neurology unit that sees many autistic patients. They've gotten a few complaints from parents, and a few staff have been injured. They want to address this, but the hospital and the healthcare system that they are part of is currently having a lot of financial concerns, and the neurology unit can't seem to get any support for this. The nurse manager and the medical doctor of that unit use this tool and find they're doing well with training in physical space. In the areas for improvement, they decide to prioritize challenging behavior because they've had those staff injured, and administration and culture because they realize that changing the approach of the unit can be very beneficial. So under the category of challenging behavior, the unit leadership work with a psychiatrist who's often on their unit to develop and provide five-minute behavior briefs to share at their shift change huddles for the next month. So brief training for their staff on challenging behavior. They have a unit safety champion, and that staff begins to collect data on the number of staff injuries due to patient behavioral events to help convince the hospital that money for safety equipment and de-escalation training is needed. Under the administration and culture category, their unit leadership find and create quotes and facts about neurodiversity to post in a staff room to simply create a more inclusive and supportive environment. A bedside nurse with a child with autism offers to be the unit autism champion and starts to learn more about this QI tool to make a plan on how they can use it more in the future. And finally, unit leadership reaches out to the patient and family experience leadership to look at their current data hospital-wide and see if they can develop unit-specific questions they could ask autistic patients and their families to get more authentic feedback on their autism-friendly practices and what they can improve upon. Hopefully, through this brief overview and these examples, you can see how this self-assessment and quality improvement tool can provide support for healthcare settings in implementing and improving their autism-friendly practices and healthcare experiences for autistic patients. We'd like your input. Please take a minute to provide that as a self-advocate or caregiver of somebody with autism. Scan the QR code here or go to the link below. It will only take you a few minutes, and it will help ensure that this work directly impacts the healthcare experiences and health of New Jersey's autism community. Thanks for your time today.